Lubunaka, and welcome to the first in the cancer series for the months of October and November. I'm your host, Priscilla, and in recognition of the Cancer Awareness Month, our focus will be on getting the experts within Oceania to discuss more about the ongoing fight against cancer. We're honored to welcome for the second time and the first of this series, Dr. Ifereimi Waqainabete, Specialist General Surgeon at Oceania Hospitals and former Minister for Health. With experience both in the operating theatre and in national health leadership, Dr. Waqainabete offers a powerful and unique perspective on cancer care in Fiji and what more we can do as a community and a country. So we'll dive right into the conversation. Dr. Waqainabete, cancer is something that touches so many families, not only in Fiji, but around the world. From your experience, how are we doing in the fight against cancer and what kinds are most common in our communities today?
Yeah, well, cancer is a real health issue. So around the world, obviously, we are a low middle income country. Yeah? So first and foremost, I usually tell patients, and in my former role, I keep on reminding those around me that once we aspire for being a high income country, we are a low middle income country. And given that, we're doing relatively well. There's a few things we're doing well. Number one is because of the good education system that we have in place, the ability to have health staff, doctors, nurses being trained not only in one institution but also have a few institutions like the one I'm affiliated with, University of Fiji, TSI Sangam. So we have a greater cohort of staff. We have greater numbers. And also the staff that we have, the doctors that we have, the specialists we have been able to go overseas, like the many of us, and have overseas experience, notwithstanding the fact that nurses have also done that. So these, together with the resources available, that are available. So in terms of the medicines, so our management of cancer is relatively, if you compare us around the Pacific, with the other Pacific Island countries, are relatively better. And the second question obviously is, what is the most common cancer? At the moment, if you just take the most common cancer, will be breast cancer. And that's what Pinktober is dedicated towards, cancer in general, but predominantly breast cancer. Breast cancer has overtaken cervical cancer in women, and cancers in general is the most common cancer for a few things. Number one is certainly, if you look at the numbers worldwide, high-income countries, places that are more develop breast cancer. We're a developing country, so our women are put at risk. There's a few factors there. Obviously, being running in the family, the fact that our women now susceptible by just the mere fact that many of them aspire, to have careers and put off motherhood to a later date. These are some of the risk factors then for developing breast cancer. But also, cervical cancer now has a vaccination, which is Gardasil or HPV. So our young ladies at 13, for example, they get the HPV vaccine, which drastically reduces the possibility of them developing cervical cancer. And then we also have gastrointestinal cancers, colorectal cancers, cancers arising from the esophagus, stomach, and then we have all the other cancers. Children cancers have their own numbers-wise, and the whole spectrum of cancer. So we have, brain cancers, we have bone cancers, but the most common is breast cancers and gastrointestinal cancers.
Thank you. So we often hear that early detection can make all the difference, but many people still hesitate to get screened. Why do you think that is, and how can we encourage more people to take that first step?
Yeah, that's a very important thing, because obviously, as I've alluded to before, because we do not have all the resources available that the first world country has. So having early detection, we don't have routine screening programs for some of the cancers that other countries will have because of the costs involved there. So early detection, and again, it's about ensuring that the person first and foremost understands what their body is. and understanding what's normal for them and what is abnormal for them. So, just an example, everybody has what we call a normal bowel habit. Some pass in the morning, some pass 2 times a day, some pass once every 2 days. What's normal for one person is not normal for another person. So it is important to know what's normal for you, and when something is abnormal, especially when you're getting older, is to bring yourself and ask to be seen. And once we have the public system, we also have private healthcare, and there are a lot of people in Fiji who have access to private healthcare because of the insurance coverages they have, or the welfare societies in which their employment is part of. And they can certainly come to places like Oceania or our other partners like PSH or DIASs or ZENS, for example, private clinic, and also get their review done and be seen. And it's always nice to go and say, look, I think I have a problem, then be told you don't have a problem, rather than having a problem and assuming that it might just sort itself out, and then later find out that you have an advanced case of cancer, which has limited options for treatment.
Right. So I think a lot of the viewers and a lot of staff here at the hospital want to know, what are some simple everyday things we can do to lower our risk for cancer, and are there habits or lifestyle choices that really make a difference?
Yeah. So there are for example, smoking we know can lead to lung cancer, but not only lung cancers, but smoking can also put people at risk from cardiovascular disease. Diets that are rich in processed food, in fats, for example, are indirectly linked to some of the cancers, like colorectal cancer, for example, but also they're linked to cardiovascular disease. So the best advice is to understand that when you are living a lifestyle because you want to prevent yourself from getting cancer, you're also preventing other communicable diseases. You're also preventing yourself from getting diabetes, high blood pressure, possibly a stroke, and kidney disease, because the risk factors are right about the same. Okay, right about the same. So I think it's good to live a healthy lifestyle. The other thing is, in terms of diet, we talk about the diet, but also exercise. And this is something that we need to do a lot of. It's a known fact that we are very good athletes. People from Fiji, we're good athletes, we're good in rugby, good in soccer, good in netball. But when you take that person who was very good playing Deans, for example, or played, Fijiana level rugby, at 30 and beyond, we just lose the fight in terms of being fit and being healthy. And we need to understand that there's a few components to a healthy lifestyle. So one is the diet, but also the most important thing is the exercise. And I often say this, just remember that when we have a birthday party and we blow the balloon, and the balloons are up, the next day the balloons will go down. Right? So for example, the lungs is like a big balloon. So you blow it today, tomorrow the lungs need another inflation. So just telling us, reminding me, for example, that the exercise I did yesterday is only useful for yesterday. Today is another day to do exercise. And sometimes we, especially when a lot of us, there's a lot of data to suggest that a lot of us now live in the urban, peri-urban areas. And so often we look at the challenges having exercises, but we need to take time out. And the weekend is also a good time to do some exercise.
Right. So thank you for that. Getting treatment can be quite tough, especially for those who live far from the hospitals or cancer centers. What can be done to make sure everyone, no matter where they live, gets the care and support they need?
If you look at our statistics, majority of the population lie within the Suwanusori corridor and the Singatoka-Tuba corridor. And they're well within the reach of a hospital or a private setup such as this. So there are lots of people who can access the public health system, but also there are lots of people who access the public health system have a capacity to be able to also access the the private health sector because of, as I've alluded to earlier, because of the workplace-based welfare schemes they have or the medical insurance that they're part of. And I sincerely request people to actually access healthcare. If you have the ability to go to the public health system, if you have the ability to access the private healthcare, that's important to be able to begin the process of sorting through and making sure whether you have cancer or not. That's one. The other thing is we are very fortunate in Fiji that there's a lot of other partners in health. So the partners in health is the NGOs. For example, Fiji Cancer Society has done a marvelous work in this area, supported by other partners. So WOWs for children's cancers, and also the development partners. Some of the development partners, for example, these are the countries, that support Fiji, and they specifically say we want to help in this particular area. But also the work that's happening in the space at the ground, the ground level. So we have, we must take our heads up for the public health teams that go around into the peri-urban and rural areas. And during this month, for example, I know from my previous role in government that they'll be going out and discussing about cancers and raising awareness around cancer. So awareness is available, and the onus is on us to have the individual responsibility to access healthcare and being able to talk to somebody and ensuring that we are on track in terms of what our health is.
Naka. So finally, is Real Mark Cancer Awareness Month for October and November. What message of hope or encouragement would you like to share with those who are living with cancer and with families doing their best to support them?
Yeah, so we support and we wish all our cancer survivors and those living with cancer the best, and we pray for God's healing for them. We understand the challenges that they face is unique and different because no two cancers are the same. But also, if we talk to them, they would also probably say that it's important to be able to prevent cancers, or pick cancer up in an early stage. And that's something that we already discussed. So I think the onus is on us to say, okay, my family member had cancer, and I've had a few family members who had cancer. But then also to say the reflection is me also ensuring that I, keep healthy. I understand when something is wrong and I get checked with, because that's, the best way to reflect on the challenges we have with cancer. But cancer is not a death penalty. We know that there are people, I've had, some people that have treated with cancer. About 20 years ago, when I was started working as a consultant, this is after my training, and they're still alive. So cancer is not a death wish. Cancer is just a diagnosis, but there's a process to the healing, and that process will involve treatment, obviously, and repeated reviews and checkup.
Naka. So that wraps up today's episode for the first of the Oceania Hospital's Health Talk Cancer series. A heartfelt welcome to Dr. Ifereimi Waqainabete for joining us and sharing his valuable insights on cancer awareness in Fiji. If you found this discussion meaningful, like, share, follow, and subscribe to hear more conversations with leaders and change makers in health. Until next time, stay informed, stay healthy, and continue with the awareness. Naka.